in most of the countries, since the lockdown has started, different policies have been presented, and it will be very interesting to hear from our speakers what they feel, if these policies has been inclusive and has been gender sensitive, and what will be the impact both during and after the pandemic. So we'll have lineup of the speakers joining us from Kazakhstan, Kyrgyzstan, Georgia, Azerbaijan, and I think they will cover different perspectives on gender and pandemic. And also, I'd like to just give brief information about Femiskop. We founded the Femiskop in Azerbaijan. It is a platform about feminism and feminist series, and in Azerbaijani language. We do articles, infographics, data visualizations, and podcasts in Azerbaijani language, and also we are preparing a book about feminism. And but we are very inclined and very happy to collaborate with regional partners, because we believe that through regional collaboration we can shed a light on these topics, because they're very regional and they're global topics. So on this terms, I would like to give the floor to our panelists. But before that, as Anaz mentioned already, if you have questions or if you have something just you would like to share or you would like to discuss, you can mention in the chats, or after the all the speakers are done with their speeches, we'll start a Q&A session, so you can ask your questions there as well. I would like to pass the floor to Aygerim, another speaker from Kazakhstan, and she'll talk and she'll reflect on the impact of the gender impact of the pandemics in authoritative regime and in the state of the shrinking civic space, which is very valid for other post-Soviet countries as well. So I think it will be very interesting to hear her perspective as well. Aygerim, if you're ready, the floor is yours.
Yeah, well, thank you, Laha, for the warm introduction. It's really exciting to be here at the webinar. And yeah, my announced topic is on gender impact of the pandemics in the restrictive states with a shrinking civic space. And what, in a nutshell, what I'm going to talk about is the impact of the COVID pandemics and the state response on the advocacy spaces and the spaces in wider definition on feminist and queer feminist groups and activists. And I'm going to talk from a perspective of a practitioner based and working in Kazakhstan. And I thought it would be nice to, if I, rather than presenting, I would try to problematize certain issues which may resonate with our panelists and audience, and hope to save up some time for interactive questions and exchange of opinion in the later half of the webinar. So if we talk about Kazakhstan's response to the COVID, we know that Kazakhstan introduced its state of emergency in mid-March, and in fact it was lifted just this Monday. And the important thing to note is that it was the first state of emergency for the state to introduce since its independence in the 90s, and it was well, it showed that the state was quite ill-equipped to navigate itself within the state of emergency and responding to the health crisis, but also socioeconomic and political crisis amplified by COVID. So, well, I want to talk about, and I invite the audience to share their opinions, as that how we create and hold the spaces and networks we plug in normal days, and then how they already shrunken space change and transform in light of the health and socioeconomic crisis. And it's true to consider it both internally and externally, because well, we've seen in Kazakhstan, for example, And I'm talking about spaces, mainly the civil society spaces, where feminist and queer-feminist groups engage in so-called normal days, that in days of pandemics, of the crisis, how the gatekeepers of those spaces actually become more vivid, so to say, and then how they in fact reproduce the system of hierarchies of rights and also exploitation, and also externally, where we often, when as feminists and queer feminist groups, when we interact, and oftentimes one of the strategies we apply, so-called naming and shaming the authoritarian states and regimes, which sometimes prove to be successful. How it could be used, or how it works or does not work in a situation where there is a clear return to so-called Westphalian state, and then retrieve to hard borders, and then where the states are very much concerned about their internal security issues rather than external issues. And I want to view that points in light of the recent case we had in Kazakhstan. In fact, the recent Women's March, which happened in Almaty on 8th of March, which was actually named by some as a historical moment, an event, as it managed to mobilize a substantial amount of women. It was first time that women marched on the public streets in Almaty, in the biggest city, and there was a clear solidarity in co-organizing this event by 4 different feminist and queer feminist groups, including Feminita, which I work with, and that it delivered the message. The manifesto was delivered. There was no police interruptions during the event, although of course there was not surprisingly show trials of activists a couple of days later, which actually gained some spotlight in media and was widely circulated in media. But what was not shown, though, is that what I want to talk about is that the fact that the feminist march happened just a week prior to the lockdown and state of emergency introduced, and it was in the midst of the parliament drafting the new law on peaceful protests and demonstrations, but and the law itself was highly criticized by the local civil society groups, mainstream organizations working on civil political rights, rights to freedom of assembly and association, mainly for 2 reasons. First, that it doesn't comply with Kazakhstan's obligation and international standards, and second, that it actually that the legislators failed to engage with certain groups of civil society, but then in turn, when we transitioned to a state of emergency, and when the draft bill was highly discussed within the civil society networks, what we've seen is that this women marchers and feminist activists were excluded from this discussion, so they were not invited to the table, and I think that actually, yeah, shows what we talked earlier, that there was this how the spaces we operate in then reproduce the systems of hierarchies, and I think we need to be, I think, mindful of that, and as we exit the crisis and pandemics and then the state of emergency, I think we, as grassroots activists and practitioners or academics, I think we should think and maybe reevaluate that. And here I also want to note that I think it's important to demystify the point of like the emphasis we give to the physical co-presence and the role of technology as this like universal leveler. And as we've seen, is actually it's not, because what we've seen is the technology and the means actually reproducing the system of and amplifying the already existing inequalities. So I think what we've seen is the amplified view that the women's issues being seen as separate realm, but by no means as an integrated part of the discussion on the table. And of course we were throughout the state of emergency and the lockdown, there were issues popping up like gender-based violence, domestic violence, but the discourse it was framed was of a humanitarian relief, rather than recognizing the political subjectivity of women itself, and also the activists and feminist activists working on these issues. So I think I leave it here and open up the floor, and I'm very happy to engage with questions. Thank you.
Thanks a lot, Aigerim. It was really engaging perspective from your side. And yeah, there are a few questions actually that might be really interesting to know your points from Kazakhstan civic space. But now I will pass the floor to Maka from Georgia, and she'll provide her reflections on specifically transgender community and maybe a bit wider approach, but it will be really interesting to know what is the impact of the COVID and pandemic on transgender community in Georgia. So Maka, floor is yours.
Hello, thank you for having me. And if there are any technical difficulties, please let me know in a chat function. Maybe I'll be looking at it. Today's intervention would be largely about Georgia and the response to COVID-19, particularly some of the economic measures that the government has undertaken to stimulate the economy and to address some of the most marginalized parts of the population. And we'll be exploring whether women fall under that category, and women that that are more marginalized than some of us. The answer is the short answer, without further ado, is that not really. But it would be interesting to look at the overall picture and the policy making in Georgia. So the policies are not necessarily gender sensitive in the country, and the women are not involved in the decision-making processes under normal non-COVID circumstances. We have only 15% of women MPs in the parliament. We have under 14% of female representation in local elected councils. We have only one directly elected mayor out of 64. And all of the governors are men at the moment. So, just very few statistics that demonstrates that, women are not really involved in decision making, and they're not, and their representation is very little to be making the impact on the real decision making processes and policy making, and then that is then reflected in the policies that are not gender responsive. I mean, we're not even talking about transformational impact, but often they're gender blind, and they're not. They just fail to recognize women as a target group. Women having all sorts of different experiences, and they're sort of omitted from this process. And of course, the response to COVID-19 has been no different. And why would it have been, right? I mean, if under normal circumstances the policies are not gender sensitive or responsive or transformative, why would they be under COVID? That would have been counterintuitive, right? Because everybody is working under these circumstances. And one of the questions that I looked at in the chat box was about that, like the government didn't have time to respond in general, but the government should not be waiting. There should be enough skills and capacity within each agency so that they're already applying the gender lenses. They shouldn't be waiting for gender experts or activists or feminists telling them what to do, but that knowledge and capacity should already be there. But unfortunately, we're not at that stage yet, and we have the reality that we have. So one of the most visible impacts that the restrictions have had on women and girls in Georgia is the closure of schools and kindergartens that happened immediately after the first confirmed case of the COVID was reported in the country. So that was well before the official announcement of state of emergency, which was quite late actually, March 22nd. But starting from early March, the schools and kindergartens had been closed. I mean, they were the first to close, and they would be one of the last entities or the institutions to be reopened. And the government has already started lifting quite a bit of the measures that have been introduced as it relates to freedom of movement or public gatherings, reopening the cities, reopening the economy, reopening the restaurants, beauty salons, all sorts of things. But there is no plan as to when the schools and kindergartens will open. And we know that this is the gender issue. I mean, of course, the kids should have the opportunity to go to school, and it's their right to education, and kindergartens are important for their development. But primarily, it is also it is a women's issue, because just like in other parts of the world, childcare is primarily ascribed to women because of the gender roles. It's considered to be women's responsibility. And just to give you some data and statistics, 68% of Georgians said 2 years ago that caring for children is women's responsibility, and only 26% said that it is a responsibility of both women and men. And only 1% say that it's primarily men's responsibility, and only 1% says that it is somebody else's responsibility. And then I want to use this as a segue, this someone else, and talk about the informal economy and the care work that women that are privileged outsource to, again, other women. So another effect of the pandemic was that the women that have been hired to help with children or around household work, these women were let go. They were the first ones to lose their jobs, and this is the informal economy, and they don't qualify for much of government's help programs. The government has introduced different modalities for cash support, basically for different target groups. But these women who are nannies or cooks around the house, they're not registered as such, so they cannot qualify as people who've lost income or who've lost jobs, because this paperwork would be difficult to generate. Also, even if you generated the paperwork, then it means that you will be registered as an income recipient, so you will be then charged the income tax. And because it's an informal economy and the salaries are so low, it's one of the lowest paid jobs, these women have not been paying income tax, and they also, if they ever get their jobs back, they don't want to be paying income tax. So it's, I mean, of course, it demonstrates that they're out of this scheme. They're not able to tap into these resources that have been made available by the government. So again, they're left out. Not unfortunately, but fortunately, we have seen quite a bit of empathy and solidarity towards people who have lost their jobs, especially the ones in informal economy. And we have seen the social media campaigns targeting those households and the individuals who did not lose their income, to try to support, to crowdfund or keep the salaries for others who did lose their jobs. And then it turned out that it's women running these crowdfunding campaigns, because under normal circumstances, it's women who are arranging this help, or they're dealing with these informal workers. And then it was again a bunch of women running the crowdfunding campaigns and helping women who lost their jobs. So it was, in a way, it was also empowering and refreshing to see that kind of solidarity among women. I want just 1 minute to talk about transgender women, because they have been hit quite badly in Georgia, and I'm sure my country is not the only exception. Those transgender women who are sex workers, they have been particularly vulnerable in this situation. They're unable to work. If they work, then they are exposed to this global pandemic, and the government's economic stimulation or aid programs have failed to address their needs. Again, there has been a crowdfunding campaign going on, which managed to cover their rent, the rent of around 50 individuals, if I'm not mistaken, for the past 2 months, and the third month's rent is up. But the government still has not done anything tangible. They've provided some groceries. One is a one-time help, but this is not really meeting the needs on the ground. And of course, there is no long-term strategy in terms of economic opportunities and employment for transgender women, or because that's also it's beyond the economic policy of the government. So I think I will just stop here. I don't want to take too much time from the Q&A, and I would be happy to answer your questions. Thank you.
Thank you, Maka. Thank you a lot. Yeah, we'll have some questions to you as well in the Q&A session. And I would like to pass the floor to Vahid Ali from Azerbaijan. And it was a nice bridge from Maka's speech in terms of the fundraising, because Vahid was very actively engaged in the fundraising himself, and he was kind of one of the co-founders of the fundraising campaign. So it would be interesting, Vahid, if you could reflect on the different gender communities, how they were affected by the pandemic, and if you can reflect a bit on your fundraising experience as well. Was it more gender sensitive as well? Could you reach out to the transgender communities and the LGBT communities in general? Yep, the floor is yours.
Thank you very much, Ella, and hello, everyone. I'll try to cover the situation of mostly minorities and LGBTI's situation, and also generally talk about the situation of the global pandemic that hit all the world. As far as I remember, Azerbaijan started very strict measures, these quarantines in the mid of March, and they have lifted, they eased them recently, probably a week ago. And also government tried to do a lot to support the people who are in need, but it was not the real support that could be done by the government. So they mostly tried not to, they tried not to let people go out and to stop the spread of the virus. And all the measures that have been taken by the government will just make people stay at their houses. And when I think these global pandemic that caused by COVID-19 showed to the people, us and all the people around, that the situation can change in a second, and you can see a lot of people who are living in super precarious situation, and they're left behind from all the measures taken by the government. Their health conditions, their housing conditions, their like basic needs to live or to survive. And we, as an activist group, we established a fund to support the people who are in need, and we have helped around 200 families, maybe more families so far. And we have told one of the supermarkets, we agreed with them to have this, loyalty bonuses cards, and we would just like putting money on those cards and giving the people the cards, and they can buy whatever they wanted to. But we did this. We started this initiative without considering any gender differences of the people. We started with the people who are in need, who needs the food like urgently. And however, on the other hand, as an activist, we as an organization, we started to do surveys with the communities, with LGBTIs, to understand their needs and also to support them. And so far we could manage to support some people, provide with the housing, food, within our, it was done collaboratively with the fund that we established and also with the activism that we have been doing. But I think that is what we have been trying to do with the situation, to have the people. But as I'd like to talk about what happened during this COVID-19 pandemic and how it affected the LGBTIs. And mostly there were like a lot of different challenges in front of the LGBTIs, especially in the countries such as Azerbaijan. And people were forced to move back to their families, to unsafe domestic spaces. And the people had to live with their families, and they should not talk about their sexuality and gender. And the ones who was not left for the families, they had to self-isolate themselves without having any some people were cut off from their support structures, as the friends, allies, or their relatives. So no one could just go out. It was some sort of unprecedented crisis that happened to LGBTI. And I would, as like most of the people know, that the most vulnerable community is the gender community who have been doing mostly sex work, and then they face almost a life and death situation, because if they want to continue the work, they will be exposed to the virus, and they were not allowed to go out. So there's no any other means to be paid and to get support. And also the measures taken by the government left a lot of people also who wanted um, to help the community. They left them. The measures left them so helpless because no one would go outside. So far, the, I I lost myself. Yeah. I'll say that the measures that have been taken by the governments, they were not inclusive at all towards LGBTIs, and people were forced to go back to their closets, to their hostile environment, to their families, especially the ones who forced to move to the suburban areas and the rural areas outside big cities. And people have lost their jobs, and they have not, they lost also the support structures such as jobs, friends, and sex work too. And it's not generally safe during even pandemic and before the pandemic for LGBTIs in such countries as Azerbaijan. And the government measures to combat the pandemic, they compromise the access to safe spaces for LGBTIs, and it is still an ongoing problem that we have been trying to help the communities to, I would say, even survive this pandemic, because it still is an ongoing challenge for them. So far, we only find out the needs of the community, and we could establish some sort of mutual support groups among the community. So people are either who had no options but leave for their family house. They are now gathering in one houses, like 6 or 8 people are living in one houses in one flat. And we are, as an activist, we're trying to support them with the basic needs, food, and sometimes rent expenses. But the general situation is really hard to find the funds, and also when it comes to fundraising campaigns, whenever people see LGBTI there like lots of homophobic and hate speech emerged from that conversations. And even today, Inter Europe released its rainbow map for 2020. Azerbaijan is the worst country again in Europe for LGBTI. So I think it tells a lot about the situation of LGBTIs during the pandemic and also before the pandemic. So it has been super hard to support the people, LGBTIs, to reach out to them too, because of this, people will first go back into the closet or their families. So it has been super hard so far, and the measures taken by the government, they were not inclusive at all. And women, gays, lesbians, and also even cisgender women, they just left without any support structures, as also the numbers of domestic violence cases says that people are just left there with the perpetrators in their houses. And but generally, I would say that not only in Azerbaijan, but also generally in the world, the pandemic showed an obvious phase of the measures that have been taken by the government even before the pandemics, the austerity measures, the cuts in social care and healthcare too, that the question that was mentioned here about the governments being the policymakers, including gender or sexualities in their laws or decisions. So it hasn't been done even before the pandemic, and even during the pandemic, they had no ideas what they should do, and also no one, to be honest, cared about the LGBTIs in such countries like in Azerbaijan. I think for now, this is what I could tell about the situation. And yeah.
Yeah, thank you a lot, Fahid, for that overview. And I would like to pass the floor to Mohira from Kyrgyzstan. It will be interesting to hear her points, her stand on the latest development in Kyrgyzstan. And Kyrgyzstan is a country with a more developed civic space, civic engagement. So I think, yeah, it would be nice to know the comparison of what's happening in Kyrgyzstan and how it's different from other countries' responses. So please, Mohira, the floor is yours.
Thank you. So unfortunately, it's not that different from other places from what we hear today from the previous speakers' reports. So Kyrgyzstan does have a very vibrant civil societies. It's a very common thing to say, but just to give you a background, what we've been dealing with here in the past few months, or maybe even a couple of years, is we have this situation of actually shrinking public space and increasing use of various means of threatening and intimidating civil activists. Yeah, to start with, this year, first encounter with the coronavirus for women's movement or feminist and queer movements here was that this was used, or the authorities tried to use the global pandemic as an excuse to ban the Women's March on the 8th of March. So I was involved in the planning and the organization of this annual event. So it's the second year in a row when we've had to defend our right to march in courts. But it was apparent to us at that point that COVID was just really an excuse, because earlier or around the same time, also trade unions were also defending their right for a strike in the courts. So they were opposing kind of the same move of the authorities to ban all public gatherings. And the initial explanation that the authorities gave was the rise of extremism, global rise of extremism or something like that. And then during the court hearings, it became apparent through the words of the state officials themselves, what they were really scared of was basically the gays, right? They were scared that queer bodies will become visible in public spaces through the use of rainbow flags and other symbols, as they were in the previous years. So this was our first kind of meeting with this phenomenon. So the state of emergency was introduced here in late March, also on the 22nd of March, I believe. it was after the fateful events of the 8th of March when we were attacked. So as we were gathering before we could start the march, the police, well, first we were attacked by unknown people. Well, it's hard to really say. Usually they are identified as like this right-wing nationalist groups. We have reasons also to believe that they work together with the police and state authorities. So they attacked the marchers, tore down our posters and banners, and physically assaulted people. And then the police basically detained all of us, but they didn't detain the attackers. So we were still dealing with the fallout and the aftermath, psychologically, physically, otherwise legally, when this state of emergency was introduced. So immediately, of course, it became very apparent to feminist and LGBTQ activists how this will affect our communities, right? So this was only a surprise for the state authorities, but our march was actually trying to call attention to the fact that home is not a safe place for a lot of people, right? It's not a safe place for abused women. It's not a safe place for a lot of LGBTQ people. And yeah, and then obviously a lot of people are precariously employed. They are disabled, otherwise vulnerable. So yeah, so immediately, of course, after people were required to stay at home, the number of domestic violence cases increased exponentially. So according to official government data, there has been a 65% increase in cases of domestic violence. There has been an increase in teenage and child suicides also during the lockdown. Moreover, because the majority of medical workers in Kyrgyzstan, 86% I believe, are women, they've been also being exposed disproportionately to the risks of being infected with COVID-19 because the personal protection equipment just was not available. It was not adequate. And so we have one of the highest rates of infection among the medics in the world. So a quarter of all confirmed cases in Kyrgyzstan was that of medics. So obviously, we can see that the government response, the state response, was class and gender blind. It was, just inadequate in so many ways. And then demands were actually made then on all these organizations, on the crisis centers that work with abused women, to set up the services urgently, for which they have no resources, and the government has refused to fund shelters, although we've been demanding funding for those, and so yeah, like the activist responses from gender, feminist, and queer movement was to dealing with security issues, establishing emergency shelters, but also providing humanitarian aid, sort of care packages, food, access to medicine, psychological counseling, and other services that are normally provided, but also some of the extraordinary services that are usually not provided. So yeah, as we're speaking, thousands of opinion pieces are being written and have already been published, or sociology textbooks are being written, international relations texts are being written about how this crisis demonstrates how the world works and how it doesn't work, and how it works in very gendered ways. So yeah, I'll stop here, and I'm looking forward to the discussion. Hope you have some questions.
Yeah. Thanks a lot, Mohira. Thanks a lot for your opinion. And I will pass forward to Nazaket to moderate the Q&A sessions, and there are quite some questions that we have received, and also we have our questions from our side. So Nazaket, could you please address the questions?
Yes, sure. Thanks a lot, Elaha. Mohira, before we kind of switch on to the other topics, I wanted to clarify, you mentioned about the teenage suicides and about the number of suicides increasing. Have there been established any direct correlation between that and domestic abuse, or what is the reason, motivation behind the suicides? Is there any reports or something?
News media reports, it does appear that, because schools are closed and people are forced to spend a lot of time together with often quite abusive relatives, it has been tied to that.
Yeah, that's quite unfortunate in a sense, obviously, but yeah, the recent reports that I've read, and also globally, that this kind of trend has been appearing on the times when the summer vacations were occurring, or like these times when people were forced to stay in the similar places more. And now that it's for such a prolonged time in a different time of the year and will stretch through the summer as well, I think the results of that are much more fatal. Another question that I would have, maybe it would be good to go back to, we have this question here, which is more relates to the presentation of Diana about digitalization, which is considered to be one of the main solutions, let's say, to the post-pandemic period. Can it change somehow the dynamics in and the gender balance in cash economics?
Yeah, and I've heard some comments about that as well. And unfortunately, very few people are connected to these initiatives. And the sort of trade we're talking about is very specific. I know a couple of sellers on Etsy and so on whose sale basically stopped because of the pandemic. They're simply not able to send the stuff from Uzbekistan. And if we're talking about sort of women in spaces where there is no particular access to quality internet, of course, Central Asia is becoming highly digitalized, and I've been writing a lot about it, that most population of Kazakhstan, for example, has the mobile internet access and so on. And it's a very growing and vibrant field, but nevertheless, not everybody and not all age groups or class groups are able to have that specific access to. You need to have a smartphone, you need to pay monthly for all these things. So yeah, it's not for everybody, basically, unfortunately, in this conditions.
Okay. So this would be a more general question for any of you to address. If you have good examples, please, let's do it. And the question is if there are any good practices from NGOs or governments to address the negative impact of the outbreak, especially towards the LGBTQI communities, and if these policies can be replicable in the other contexts and countries you see, like from more regional perspective. Who would like to go on with that? I think I'll unmute all of you.
So I can start maybe.
Sure.
So in Georgia, I know that the administration of the government, which is leading the policy work from the government side, prime minister side of things. They're taking an initiative, and they're meeting actually today with the community organizations to discuss the medium to long-term strategy when it comes to meeting some of the needs of the LGBTQI community amid COVID-19. We don't know where this will go, but I think this is a positive development in terms of recognizing the issue, seeing the community, and holding this meeting. And hopefully it will transform into something tangible. But at the moment, I can only speak to that fact that there is a meeting scheduled today. I also know that it was the administration of the government who initiated the provision of the food and groceries to I think transgender and lesbian women specifically. But this is pretty much it. And of course, this is very little, but that's the only thing that I can think of right now from the Georgian context. We cannot hear you.
I can respond. Yeah. Yeah. So unfortunately, for this kind of best practice learning, there has to be a political will for learning. And unfortunately, we also learn from history that this type of situations, they demonstrate which kinds of bodies are seen as sacrificial, that yet sacrificable, right? Which ones are seen as dirty, contagious, stigmatized. And so the AIDS epidemic, the HIV/AIDS epidemic, history of that teaches us a lot, yeah. Unfortunately, for instance, also in the United States, it looks like that as soon as the racist government realized that minority communities are affected the worst, they became less concerned, and they started talking about, need for the sacrifice. And so, so I think, that's kind of the depressing part of this, that for this learning to happen, it needs to be seen as something that needs to happen. That is beneficial and required.
I agree in a sense that because the idea initially has been, or the discourse, that this virus is very democratic in a sense, and that it can infect anyone from very rich and empowered white men to very vulnerable groups. But I think how the reality turned out to be as the pandemic progressed and as we were kind of put under these severe conditions of quarantine, we've seen that the most vulnerable groups were hit most hard. And this is something that I've been kind of, unfortunately, get approved of from everything that you were bringing from very different contexts and countries, that this is really the case. And it again shows that how the inequalities, socioeconomic inequality that we have globally in our global capitalistic economy, it kind of becomes much more severe and has much more fatal and adverse effects on those vulnerable groups once something like this happens of this scale. And when thinking about the post-pandemic period, I would also be curious to hear your opinions on what do you think, if it will bring anything novel to the discourse that we're having, or that if it will bring, even like on a very humanly level, a bit more empathy towards people who are in those vulnerable positions, who are always kind of been put in an equal position. So maybe it would be nice to hear from Aygerim and Vahid on that, if you think, and the others, if you also want to add that. What do you think if this will bring some novelty to the discussions that we have, and then maybe help at least to have a bit more of a say in this power balancing game?
Yeah, sure, I can take up this one. It's actually a good question, and our initiative actually started needs assessment survey of lesbian, bisexual, queer and trans women in Kazakhstan, and we launched it in April. And then it was initially a rapid survey, like an express survey, that to map up the immediate needs and problems, and immediately the themes like domestic violence, both physical and mental, and socioeconomic precarity, and access to healthcare and state services was revealed that the effect on LGBTQ community specific and amplified in Kazakhstan, but then we immediately, later we also understood that although we have this preliminary findings, that we need to, and that we're planning to do a second part of it later, at least like half a year later, because the impact, because the crisis is protracted, and the impact, mainly socioeconomic impact, will hit later on. And I think we still have, even us, still haven't realized the full picture. So whenever, and then even in the immediate circle, when we had interviews or discussions, then a lot of people with relative privilege who could like telecommute were saying that I was like affected relatively, but we know, and it's also a question to sustainability of civil society and queer feminist groups, how the movement would sustain itself, because because a lot of funding, or because funding is drafted a year or two ahead, right? So maybe we don't feel it now, but it's going to hit us in a year, half a year or a year, or depending how much of a security bag you have with you. So
yeah, for sure. Would someone else like to add to this? Okay, then I think I'll move to the next question. I mean, the points you said, I think are very important, especially the sustainability and durability of the feminist movements in the post-pandemic period, because I also feel like, again, going back, that we have been trying to have a bit more positive outlook on what will happen after this period is over, in a sense that we want to carry hope that this will bring change, because we saw that some things can change, more probably on the terms of the climate change rather than the intergender issues. But also from the feminist perspective, I've seen that the main point has been that this crisis has shown us how far we still need to go in order to achieve some results, because we were kind of, at least the topics of the domestic violence and the issues of the housework, they were also not addressed in the latest, let's say, momentums of the feminist movement globally, like the Me Too movement, let's say. They didn't really address these issues, which we're seeing as the most urgent at the moment. And I feel like probably, at least in terms of shaping the agenda for the future of the movement and showing what our weakest points are, it kind of brings us back to some basics, how, no matter how like hard it is to say this, and I'm not sure if this is a right formulation, but like issues that were very basic and we were trying to fight them, have been trying for centuries, and they're still there, they're still present, and they're as strong as ever, I feel like. So how do you think, maybe it would be good to get an input from each of you, will this affect your agenda of work for the future, and what will you, what kind of new lens will you bring up to your work, or like what kind of issues do you think that will be like most dear to your heart after this pandemic, or do you think it will not change much and you will still continue in the same vein? Feel free to unmute yourself. Yep, Mohira, you can start.
Yeah, so our movement, the organizers of the Women's March, we're called 8 by 365. So we published a text, and we started like a sort of a flash mob in May under the hashtag of «Сидит дома не работает», so she sits at home, doesn't work, where we were talking about these issues of invisibility, and basically I was reading the Sick Woman theory, and I'm working on a translation of this text, and it's basically about practicing this feminist ethics of care and solidarity, and recognizing that this system where your survival depends on your ability to work is not sustainable, and that we need to be fighting as feminists and queer activists. We need to be fighting for all of these issues of, universal health care, universal basic income. All of these issues should be our central issues, because they ensure that when we find ourselves in a situation like this, we're not trapped with abusive partners, we're not going hungry, we have access to safe abortions and the required medication, and we don't have this kind of attitude that people are disposable. So that's something I think that I'm taking out of this.
Maka, would you like to address it?
Yes, I would like to. Unfortunately, I'm still, or maybe fortunately, who knows, but I'm still very much in the processing phase. I don't really know what I would be walking away from this with, or when, right? I mean, we don't know whether we are walking away from this at all or how soon. So it is very difficult for me to imagine prior how it will reflect on my approaches. One thing that I've been thinking increasingly about is access to technology and internet, which has become it has become the essential necessity. We are no longer able to do anything without this technological. It's not an advancement, it's like a necessity. So I think that's definitely something that I would probably be paying more attention to, because I've been working with some kids as well, school, with Sunday school. I've been doing some classes on different aspects of gender equality, and I see the differences there, how how this affects people differently. Not everyone has access, not everyone has data. It can be very expensive in certain countries, and then it comes the whole gender dimension. You have this budget for in the family for internet, and then how much like who gets a hold of that budget. Are they sons, are these daughters? Like, are parents really careful in terms of making sure that their children have equal access to both internet but also the technology? If you have one laptop, how do you share? Like, how do you get your homework done? Because in Georgia, homeschooling is done. It's all like classes are online because the schools have been shut down for the past almost 3 months now. So are girls falling behind? Is there going to be a gap of what sort? What are going to be the implications? So I guess I'll be applying more of I guess I'll be thinking more about those issues and trying to more actively to see where the gaps are. And I don't think that COVID has created those gaps. I think COVID just has helped us or is helping us to see these differences. Of course, we know that, that there is a gender difference and divide, but now we actually see that girls may not be able to catch up. They may not be able to actually move from one grade to another or from one class to another. So that has become more tangible in a way, more vivid and more painful even. So yeah.
Yeah, very interesting. I have not even thought of that aspect. Like, there's so many things when you get the different perspectives and so many points where there are like, yeah, the new kind of inequalities can be created. Like before, if they could all go to the classroom, now it's about priorities. And especially for those in their last years, I think it might be very kind of a tricky situation. So I will move. Igeriam, if you would like to add to this as well. You talked already a bit about the needs assessment and the shortages, but I would,
sure. I think for me, I think it's my hope, or would go in line with what already in line with points raised by Moira about the socioeconomic rise, and I do really hope that that socioeconomic rights and independence or autonomy, whatever you call it, would be central for activists and a lot of people involved within the feminist and queer feminist discourse, because I think it was also interesting to see how many people they did not realize that they do not belong to the middle class, so including within the activist spaces. So yeah, they were like going to conferences or like having their honoraria paid, or like, yeah, so they had certain stability. And I hope that this crisis helped to like for the coverage to fall, and for people to realize that, and that would help for them to become champions of the socioeconomic rights, which for a very long time been like shrugged off or been like considered as like secondary, or like a younger brother of political rights. I think that's my hope.
Yeah, that's very interesting how, we all, like not we all, but certain people really fell down a class kind of difference and became more visible with this crisis. Diana, would you like to add as well to this question? Yeah. Even though your work is a bit more in academic terrain, that would be also interesting to know how this will impact your research maybe.
Yeah, and actually even, I mean, I'm to follow trends in a way. Obviously not a trend, it's something that changed our world and transformed it. But it coincided with my research on resilience building in these communities. So and I'm already in the process of trying to understand how we can sort of draw local resources in order to understand what would be the best way to build mechanisms to be resilient to these crises in the future. Because it showed that this crisis in particular, and all the crises that are happening now, with like, there's the outburst of the dam between Kazakhstan and Uzbekistan, and how people on the ground are helping each other, and we're seeing the news is sort of this is an ongoing process. So I'd be very interested in seeing and sort of researching how communities respond to that, because as we see now, mainly the response coming from the communities and people helping each other. So I think, unfortunately, this comes out always in the time of crisis, whenever it happens. And we've seen this wave sort of public engagement that has been going on in my memory, at least for the past 10, 12 years in the region as a whole. So I'll be very interested to sort of trying to conceptualize and hopefully providing some implementation for beyond academia of how these mechanisms can be applied in the future.
Yeah, thank you. It's very interesting that, yeah, the research is on resilience, and this is kind of the very major resilience challenge. So I would be interested to get to know what comes out of this further on. Vahid, will you also like to at last to add to this?
Yeah, I can add just something because I totally agree that the coronavirus was sort of amplifier of the existing inequalities that was in our societies, and it showed all the injustice, like, and insecurities. You can see it with naked eye now. And as someone mentioned before, that it's not the first crisis that the LGBTI community is facing. We remember the AIDS crisis and how most of the governments in Western countries, they very slowly responded to that. And what happened after these very slow responses was the community, LGBTI community, was super resilient, and they came together and started to fight and demand the healthcare. And I hope that also the coronavirus caused by the COVID-19 would help the not help, but be the reason why the LGBTI community, the feminist communities are coming together to fight the inequalities, insecurities, and injustice in our societies, and demand the healthcare, demand the basic income, and demand the fight with the roots of the problem, not the surface consequences. And I hope that this crisis would also show mostly, these emerging neoliberal feminists to see the real problem behind all the problems that they're fighting against. Like, the class issues should be discussed after this crisis, and healthcare and social protection of the people. But that's just are the hopes. But let's see what will happen. And
Yeah, this is kind of your point on the cooperation resonates with the next question also that we have, and I think this is the final one, so that we will wrap up in kind of a bit more than the time we promised. The question is if there is more need for regional cooperation and exchange knowledge and expertise. If yes, what kind of steps can we undertake to increase this? This has been something very interesting personally for me as well, as I think as an organization for Femiskop as well, as a collective, so to say. Because we've been, I think it's not very often that we have this more, let's say, regional level exchange between the countries, but even if it happens, I feel like most of the time it's something that is imposed by other institutions rather than the collectives finding the common ground and coming together. So I would like to hear whoever of you have a kind of an opinion on that and would like to say something, please feel free to respond.
Can I? I really appreciated this initiative to bring us all together in this webinar. I think it's very important that we talk to each other. I think it's not done enough. Even like if we think outside of crisis, I think there's a lot of things we can share and learn from each other. So I really appreciate being included in this and hope this continues in some form.
Thank you. What any Other of you want to add, Ilaha, if you want to add something to this? And
Um, yeah, I think it's really important, and I mean, there can be different mechanisms how we can involve regional collectives and regional initiatives. I think it can be through some events, physical events, or like this kind of online workshops, exchanges, and even through sharing the research, which is not a lot, but there are some research being done, and it's very relevant for the other countries' realities and institutional setup. So, and it's really important to be aware of what's happening in other countries, neighboring countries, or in the similar historical background countries, to understand that there are similar patterns. There are certain differences, but there are similar patterns, and there, for sure, we can learn from each other. And that's, yeah, it makes the community much stronger, both activist community and research community much stronger, to know that there are similar issues and similar solutions out there, and then that, yeah, we can progress through learning from each other.
yeah, I certainly agree on that as well, that the exchange of knowledge and creation of a collective knowledge is something that has proven to be very important, especially during the time of this crisis. But I think also in the time that we call normalcy, it's just not normal, whatever we have in the normal world as well. So there are many things to fight even in the world without the pandemic. So, but probably the fact that so much has shifted to the online domain in this during this crisis have incentivized more of those exchange and more of this collaboration within the online space, because the physical space was taken away from us. At this point, I would really love to thank you a lot for your time and commitment and very interesting and insightful points. I think I personally really need a bit more time to digest all the pronounced thoughts and also come to certain conclusions, and think how we can also continue working together, cooperating, or at least providing some ideas, support idea-wise, even when it's not something material. In the following times. And I would like to thank everyone who stayed with us here, all our attendees. I hope it was an interesting discussion and a webinar for you as well. And well, keep an eye probably on our Facebook pages, on our website, which is mainly on Azerbaijani now, but when we do have this kind of events, we will definitely have posts in English. And we can also keep you informed via mailing list and etc. So please do keep in touch with us, and hopefully we see each other sometime soon physically somewhere as well. And good luck with all your hard and dedicated work. I hope it comes to at least a bit of satisfying conclusions at some points. And yeah, thanks a lot for all the work you're doing.